The epidemiology unit of the Ministry of Health says that 13,323 cases of dengue have been reported in the past 6 months. Whilst the highest number of patients have been reported from the Western Province, the Colombo municipality has the unfortunate distinction of being the worst affected. The Chief Medical Officer of CMC, Dr. Ruan Vijayamuni, says that the situation is dire in the Colombo North and Colombo East areas.
The rapid spread of dengue has been attributed to poor hygiene in homes, offices and workplaces. Health authorities know that the dengue-carrying female mosquito can lay up to 200 and 300 eggs at once. A single female mosquito can lay up to 1,500 eggs in her short lifespan, and with about 50% of these eggs turning out to be female, this has been cited as the main cause for the increase in the mosquito population. Doctors say that locations conducive to mosquito breeding must be destroyed in order to eradicate this menace.
Dengue මර්ධනය සඳහා දීර්ඝ කාලයක ඉඳලා නීති පනවලා තියෙනවා. නමුත් අපිට අදත්
laws have been implemented for the eradication of dengue. However, we are still speaking about this disease even today. Where did we go wrong? Rather than pointing fingers at the authorities, we should change our habits.
අපේ පුරුදු වෙනස් කරගත යුතුයි.
There are countries in this world like Cuba and Singapore which have won this fight. This has been done through public participation. As individuals, each of us has a responsibility for our lives and the lives of our children. And if we are not proactive, the dengue epidemic will continue to spread and it will end in a catastrophe.
5,044 dengue cases have been reported from the Colombo district this year. 1,303 patients have been reported in the Colombo municipality. 14 patients were reported from Kirlopana yesterday alone.
The main causes for the high number of dengue patients reported from areas like Modara, Mutwal, Mahawatta, Kirula, Kirlopana and Grand Pass South is the high population density and the number of small homes that are packed together, which creates a higher probability of mosquito breeding within these homes. The problem is that the people in these areas have not turned their attention towards cleaning up areas conducive for mosquito breeding as observed by us.
While 78 patients are being treated for dengue at the National Hospital in Colombo, hospital authorities say the condition of 17 patients has elevated to the more fatal dengue hemorrhagic fever.
Patients with dengue hemorrhagic fever receive special attention. We have a large number of patients with fever arriving at the outpatients department. Over the recent past, we have taken steps to see patients with fever separately, and if their fever persists for more than 2 days, on the third day we take a blood sample and we are able to determine quickly, within 20 to 30 minutes, whether they are patients who are at risk of contracting dengue.
20 children are being treated for dengue at the Lady Ridgeway Children's Hospital in Colombo, while 5 children have been diagnosed with dengue hemorrhagic fever.
There has been a significant spike in the number of patients over the past several weeks. When you develop a fever, instead of experimenting with various treatments, visit a qualified doctor. Do not use other medication. At times, certain types of medication can induce hemorrhaging. This further complicates the patient's condition. A situation could arise where it is difficult for doctors to diagnose patients.
Director of the Colombo South Teaching Hospital, Dr. Asila Gunawardana, says that 161 patients are being treated for dengue at the hospital. 2 of them are in the intensive care unit.